Welcome to this clinical walkthrough on the Intertrigo case for UK MLA brought to you by Mediate, your 24/7 practice partner. Today, we're going to break down exactly how you can ace this OSCE station, step by step.
So here's our game plan. We're going to walk through the 6 key stages of the consultation, right from your opening words and history taking, all the way through to creating a solid management plan and closing the station safely.
All right, let's kick things off. That confident start, it really does set the tone for the entire consultation. Your first job is simple but absolutely crucial. Greet the patient and confirm you've got the right person.
This phrasing right here is simple and effective. Using these exact words makes you sound polite, professional, and it ticks that all-important patient safety box right from the get-go.
Okay, with the patient's identity confirmed, we can dive into the history taking. A systematic approach here is absolutely key to reaching the correct diagnosis.
So the patient has a rash. You need to get them to open up and tell you about it. How do you do that without leading them or putting words in their mouth?
This right here. This is your golden phrase. It's such a simple open-ended question, but it invites the patient to tell their story in their own words. It's the perfect way to start gathering information. After that open question, it's time to get specific. A framework like Socrates is your best friend here. So you'll ask about the site, which is below the breasts, the onset, 4 days ago, and if it's getting worse, which it is. The key findings you'll uncover are that the rash is red, sore, and sometimes feels wet.
It's so important to mentally summarize your findings as you go. So what do we established? A continuous, red, sore rash that's getting worse and feels wet. Think of these as the crucial building blocks for your diagnosis.
Now don't forget to complete the rest of your history. In this scenario, there are no previous episodes, no other medical conditions, and no medications or allergies. These negative findings are just as important as the positive ones for ruling out other causes.
Don't skip this next part, so many people do. You always need to ask about the patient's ideas, their concerns, and their expectations. This is how you build rapport and create a management plan that they'll actually follow.
And here we go. This tells you the patient's main concern. She wants relief from the itching and for the rash to go away. You have to keep this goal front and center when you start discussing the management.
Okay, with a solid history under your belt, you can now form your differential diagnoses and start planning your physical examination.
Your history is pointing strongly towards Intertrigo, a red, sore rash in a skin fold. That's going to be your top differential. But you also need to keep other possibilities in mind. Could it be atopic eczema? What about impetigo, especially if there's any crusting? Or even cellulitis if there are signs of a deeper infection?
Your examination plan needs to be focused. Start with observations to check for any systemic signs of infection, do a quick general exam, and then zoom right in on the rash itself, noting its appearance and distribution.
Now we're at a critical skill, explaining your diagnosis. Your communication here has to be clear, simple, and empathetic to be effective.
You have to avoid medical jargon. Use a simple explanation just like this one. Calling it a sweat rash is so easy to understand and immediately makes sense to the patient. And mentioning the potential for a fungal infection sets the stage perfectly for your treatment plan.
It shows you've listened and examined her before sharing your professional opinion. This is how you deliver a diagnosis with confidence and build trust.
A patient will almost always ask if their condition is serious. Your answer has to be balanced. You want to reassure them that it's not dangerous, but also explain why treatment is necessary to stop it from getting worse. This is what motivates them to follow your advice.
And speaking of mastering skills, you can practice this exact case right now and get instant objective feedback on Mediate.com. Repetition is what builds the confidence you need for your exam.
Next up, let's build the management plan. Presenting your plan in a structured way is how you show the examiner that you're competent and thinking clearly.
Using a 6-point structure like this one ensures you cover all your bases. You'll move from senior review and investigations to symptomatic advice, treatment, referral, and safety netting. It is a comprehensive approach that shows you're thinking about the entire patient journey.
Symptomatic advice is all about empowering the patient. These are practical steps they can take themselves. Focus on hygiene, like patting the skin dry instead of rubbing, and lifestyle modifications, like wearing a cotton bra and considering weight loss to help reduce skin folds.
For the definitive treatment, you must follow the established guidelines. Your first line is a topical antifungal. If there's a lot of inflammation and itching, you can add a mild topical steroid like hydrocortisone for about a week.
If that doesn't work, then you escalate to oral antifungals.
Finally, let's talk about safety netting. This is an absolutely critical step to make sure that patient knows exactly when and why to seek help if things don't go as planned.
You have to be specific with your safety netting advice. Tell the patient exactly what to look for. If the itch and soreness become severe, or if the rash doesn't start to improve with treatment, they need to come back for a review.
And that's our walkthrough of the Intertrigo station. Remember, the keys to success are structure, clear communication, and a patient-centered approach. To put it all into practice and perfect your technique, head over to mymediate.com now.